Hello, everyone. This is Jeffrey Moy welcoming you to this presentation on the Culture of Health Leaders program. Today, we will discuss Culture of Health Leaders, what the program is about and who we're looking for, what the participant experience is like, and what you can expect in the application and review process. We have designed this presentation to respond to the frequently asked questions we receive about the program. To get us started, we have Uma Viswanathan, Senior Program Officer at the Robert Wood Johnson Foundation, to provide an overview of RWJF's Leadership for Better Health programs, as well as some context on how these programs fit into building a culture of health.
Thanks, Jeff. I'm so pleased to be able to be here with you on this webinar to be able to talk a bit about the Foundation's Culture of Health Leaders program. So my plan in the next few minutes is to share a bit about our Culture of Health vision and our approach to supporting leadership for better health more broadly. So what is a culture of health? So imagine a culture in America where everyone has a fair and just opportunity to live the healthiest life they can, regardless of ethnic, geographic, racial, socioeconomic, or physical circumstances. Imagine a culture where we embrace a more integrated, comprehensive approach to health in our healthcare system and in our daily lives. And imagine if our idea of health encompasses healthcare and the many other critical factors that impact people's health, including early childhood development, education, housing, jobs, and the built environment. That's a culture of health. And it will look different in every community. We recognize that it's an audacious vision, and it requires us to tackle the root causes of health disparities, such as racism and poverty. It requires unprecedented collaboration, with everyone playing a role: parents, coworkers, neighbors, civic leaders, policymakers, business leaders, and people across industries. It requires people are able to work collectively towards shared goals, breaking down the silos that exist between us in unprecedented ways. So, as part of the Foundation's Leadership for Better Health vision, we took some time to design with members of the field what we actually mean by a leader for a culture of health. And we crystallized it around these core concepts that a leader for a culture of health envisions and declares a future in which everyone has a fair and just opportunity for health and well-being. A leader for a culture of health takes action to advance equity, diversity, and inclusion, and creates space for others to come together within and across organizations, sectors, communities, and networks, contribute to this future. So you can see here some of the core strategies that RWJF takes around leadership for better health, in which we really pay attention to the people side of change. So we are looking to develop strong interdisciplinary networks of leaders from every sector who have a shared vision of what shapes health and a desire to work together. Through our leadership programs, we're equipping doctors, nurses, and other healthcare providers to transcend their traditional healthcare roles, work together across disciplines, and help address complex local health challenges. We support efforts of individual scholars and interdisciplinary research teams to identify the barriers that must be overcome to achieve health equity and apply research findings to spark immediate community action and solutions. We enable leaders in all fields, such as transportation, urban planning, business, and economic development, to challenge systems, tackle the root causes of health disparities, and build healthier communities. So you can see across these four core programs of the Health Policy Research Scholars Program, the Interdisciplinary Research Leaders Program, Clinical Scholars, and the Culture of Health Leaders Program, that we are funding visionary thinkers who are committed to bringing about meaningful change, particularly individuals who work and live in communities with limited resources and opportunities. We're building the interdisciplinary skills and relationships necessary to extend the influence and impact of leaders working to build our culture of health. And we're doing so by really paying attention to this idea of building a network of committed people driving health equity across fields.
Thanks, Uma. So I am excited to share information with you about the culture of health leaders specifically, a tremendous opportunity for leadership development for leaders from all sectors and disciplines who are dedicated to creating healthier, more equitable communities. The Culture of Health Leaders program is co-led by two organizations who are focused on health equity, the National Collaborative for Health Equity and Common Health Action. The National Collaborative promotes health equity by harnessing evidence, developing leaders, and catalyzing partnerships across the many different sectors that share responsibility for creating a more equitable and just society. Common Health Action aligns people, strategies, and resources to generate solutions to health and policy challenges. Together, our two organizations partner as the National Program Center for Culture of Health Leaders, operating out of Washington, D.C. In addition, we work with a great team of partners who represent some of the sectors that are crucial to bring together to build a culture of health. For example, we work closely with the Center for Creative Leadership in developing our program curriculum and assessing our leaders' development throughout the program. So what is the Culture of Health Leaders program? As Uma described, we know that our nation needs a generation of leaders who understand that in order to provide everyone in America with fair and just opportunities for health and well-being, we need to find solutions in new ways. Their ability to influence, inspire, and lead in rapidly changing environments, collaborating with others from diverse sectors and backgrounds, is critical to building a culture of health. Culture of Health Leaders will create and support networks of visionary leaders who can break down silos, tackle the root causes of health inequities, and successfully lead in these complex and challenging times. They will build bridges between health and other factors that have such an enormous influence on people's lives and their health, where they live, learn, work, and play. They will transform our culture at every level, putting health and equity at the core. This structured three-year program provides opportunities that many people have not had the benefit of: formal leadership training, the opportunity to work with professional coaches, and the chance to network with and learn from others tackling similar challenges from different perspectives. So who's eligible to join the program? There is no minimum education requirement and no requirement to be in graduate school. The only age requirement is that applicants must be at least 21 years old as of September 1st, 2020. There is no upper age limit. Applicants must be U.S. citizens, permanent residents, or individuals granted DACA status. And government employees who are not considered government officials are also eligible. Please see the footnote on page 2 of our call for applications for more details on this definition. This year, the Culture of Health Leaders program will select up to 40 individual participants. Please note that we do not accept team applications. We are looking for leaders from all sectors, public, private, nonprofit, and social entrepreneur, and all disciplines, including technology, education, housing, business, transportation, the arts, and many others. With a firm commitment to diversity and equity, those from a broad range of disciplines, geography, and backgrounds are encouraged to apply. Here you can see a snapshot of where our newest cohort of leaders live, all over the mainland United States, Alaska, and Puerto Rico, and from urban, rural, and suburban communities. When you add in our two other current cohorts of leaders, as well as our alumni, you'll see even greater representation of communities from across the country. You can find more information about our leaders and the communities they work in on our website. So what kind of applicants are successful in joining this program? It may be you if you are highly motivated to advance health equity and able to speak to your vision of a culture of health. If you're open and ready to learn and be coached in collaboration with other leaders from across the country, valuing their perspectives. If you embrace complexity, ambiguity, and risk-taking with a commitment to lifelong growth and development. If you're willing to or have proven experience working and thinking collaboratively across sectors and disciplines, not with a narrow focus on one area. It may be you if you exhibit leadership capabilities through your work and volunteer experience and want to continue developing strong critical and systems thinking skills to take your influence to the next level. And it could be you if you understand the value of diversity, equity, and inclusion in building a culture of health in organizations, communities, systems, and the nation. We've talked a little bit about the program and the kind of people we're looking for, but what is the experience like for our leaders? Our program model is based around developing 4 areas of mastery: mastery of self, mastery of relationships, mastery of environment, and mastery of change. Throughout the 3-year program, participants continue to work on related competencies and practice reaching beyond professions and fields to generate sector-spanning solutions in order to build a culture of health. Specifically, leaders are expected to spend 32 to 38 hours per month on learning, coaching, and connecting. This work occurs primarily through online learning, as well as up to 3 program convenings in person annually. Convenings take place all over the country. In the past year, leaders met in Indianapolis, Indiana, Raleigh, North Carolina, and Albuquerque, New Mexico. Convenings provide opportunities to learn from subject matter experts, receive in-person coaching, and learn from each other's experiences. Attendance at these convenings is required for all leaders, and the cost of travel and lodging is provided by the program. In addition to our program convenings, RWJF's Annual Leadership Institute provides an opportunity to network with leaders from all of the Leadership for Better Health programs that Uma mentioned earlier. Leaders learn from national leaders in areas such as change management, equity, diversity, and inclusion, or EDI, and social innovation. Year 1 in the program is focused on personal development. Once leaders move into year 2, they begin work on identifying and planning a bold strategic initiative, which is then launched in year 3. We get a lot of questions about strategic initiatives, so to be clear, applicants are not required to identify a strategic initiative or project for their application. There's no expectation for you to apply with a specific focus in mind. We are more interested in understanding what emerging vision you have for your community and the connections you are considering in working towards a culture of health. Leaders receive an annual stipend of $20,000 to support their time in the program. The stipend can be used for things such as release time, living expenses, including childcare, additional consultant fees or professional development like conference registrations, and supplies that you may need. Leaders are expected to identify a sponsoring institution that will handle their stipends. The sponsoring institution is typically the leader's employer, but does not need to be. Again, please see our call for applications for more details on the specific sponsoring institution requirements. You do not need to have a sponsoring institution selected when you apply, but you will need to have one later on in the application process. Let's move on to the application and review process. The application consists of clear responses to questions about your leadership experiences, both informal and formal, your vision for a culture of health, your experiences collaborating with organizations or other leaders, and your readiness to engage in change that advances equity. It also includes a video that provides a brief glimpse of the opportunities and challenges to building a culture of health, and 3 references from people who can describe your leadership or emerging leadership qualities. I'll provide more details on the video and the references in a moment. Please note that all application materials should be submitted online. Please do not mail in any materials. And all parts of the application must be uploaded before you can submit your application. The application deadline is Wednesday, February 19th at 3 p.m. Eastern Time. As I mentioned, one part of the application is a video, which is intended to supplement the written application. This video is an opportunity to bring your community to life for our reviewers. We encourage you to go out and show us your community. It must be no more than 3 minutes or 180 seconds. Videos longer than 3 minutes will disqualify your application. The video must also not be professionally produced. In other words, it should not be existing content that was paid for by your organization. It can be created on a mobile device, and it should be specifically created for this application. There are more detailed instructions on how to upload your video in the application. Again, this must be uploaded with all of your application materials by February 19th at 3 p.m. Eastern Time. We strongly encourage you to upload your video far in advance of this deadline, as it can sometimes take longer than expected. You will also need 3 references for your application. Specifically, you will need references from the following 3 types of people who can attest to your leadership or emerging leadership qualities: a supervisor, board member, or team leader who has experience leading you in a volunteer or professional role; a peer leader who can describe your leadership style and peer interactions; and finally, someone you have led in a volunteer or professional role. Again, you must have 1 reference from each of these 3 categories for your application to be considered complete. We recommend that you invite your reference writers as soon as possible. We have asked references to submit by February 14th. Since you are not able to submit your application until all parts are complete, including these 3 references, this provides you with a few days to follow up with your references and ensure that all of your materials are all ready to submit. When you enter your references information in the application to invite them, they will receive an email with information on how to complete the reference form. You should include in this email which of the 3 roles you are asking the reference to respond as, so they are clear. References will answer specific questions in the application form. Please do not fill out these sections yourself. They should only be completed by your reference writers. References cannot be current or former members of RWJF staff, RWJF board members, staff members of the National Program Center, National Advisory Committee members, or application reviewers. In terms of the application review process, applications go through a multi-step review process with reviewers representing a variety of sectors and disciplines. The initial review of applications will take place from mid-February to early May. Then in early May, invitations will go out for semi-finalist interviews, which take place from May 12th through 21st in Washington, D.C. Each interview takes about a half day. Materials and scheduling information will be sent in early May for those who are invited to this phase of the review process, which includes panel interviews as well as a short presentation. The notification of awards takes place in mid-June, and the program launches on September 1st. So to go through the major points of the timeline one more time, applications are due by 3 p.m. Eastern Time on February 19th. Semifinalist interviews will take place in Washington, D.C. from May 12th through 21st, and finalists will be selected in mid-June, with the program beginning September 1st. Please note that there will be a required in-person program orientation in the fall, and RWJF are planning to hold their annual Leadership Institute, the opportunity to meet participants from across the Leadership for Better Health programs, in the spring of 2021. We are still determining the exact dates and locations for these meetings and will provide updates as soon as they are available. If you share our vision for leadership and meaningful change and want to take the next step in your leadership journey, or you know someone who does, we encourage you to apply or to share this information. Please continue to visit www.cultureofhealth-leaders.org for updates, as well as answers to frequently asked questions. Be sure to review the call for applications and the resources on the My RWJF website for additional guidance on completing your application. And don't forget to follow us on social media as well. Right now, we're on Twitter, LinkedIn, and Facebook. If you think you would be interested in any of the other Robert Wood Johnson Foundation Change Leader programs, information about the other 3 programs are on our website, and you can email changeleaders@rwjf.org for more information. Thanks for joining us, and we look forward to your applications.